So let me turn it over to Joanne Ahola, who is an old friend and a psychiatrist. We got to know each other through the Asylum Network of Physicians for Human Rights. And Joanne has a long history in that field. And actually, weren't you the founder of the Weill Cornell Human Rights Clinic?
I was one of the founding medical directors.
Right.
Yes. And you know, Yana, you were one of my trainers in 2000 doing asylum work.
I can't believe I was your trainer, considering that you have written the Istanbul Protocol. The Istanbul Protocol, for those of you who don't know, is a UN document that outlines methods for evaluating victims of torture. So we were both doing that, and Joanne, I think, is still doing that. And also she is an LGBTQ activist as well. So, Joanne, I'll let you take it from here. I'm looking forward to listening to all of you.
Hi, everyone. Thank you for panelists for sharing your expertise and being here, and to all our participants for being part of this event. I want to start out by quoting something I see that one of our panelists wrote. This is from Ivy Wolf Turk. She wrote, "This pandemic is unlike anything any of us have ever experienced. Whether we're facing sudden economic hardship, fear for our health and the health of those we love, grief over a devastating loss, or the unnerving prospect of being homebound for months, all of us are being challenged to rapidly adapt to a life in a world we couldn't have imagined." And this is so true. It is true for us. It is true for the people we serve in all of the organizations that are represented here today. And so it's with Jana's vision to bring together this event so that we can share not only experiences, but more especially, I think, expertise and efforts that you found that have been successful, effective in helping the people we work with meet the challenges that we're faced with today. And so we have, I think, nine people speaking today. We've got an hour and a half. And so each person on our panel will be speaking for 5 minutes. I apologize in advance. I'll be a little bit strict about the time. I'll try and give you a warning at 4 minutes, and then you'll hear some chimes at 5 minutes. And by doing this, we'll get to save plenty of time at the end. I know that among the participants listening today, there's lots of knowledge and experience as well as questions. So we want to leave time for that. For everyone, please feel free to write comments, ask questions, panelists of each other, participants of everyone. And then when we come to the discussion Q&A section, we'll have some good questions to dive in on. So the first person I'd like to invite to speak to us is Dawn Diaz, who is the founder of Milagros Day Worldwide, which empowers survivors of domestic abuse through coaching and mentorship. And so Dawn, please, if you would share with us your experiences, things that you found successful and effective in this time. Thank you.
Hello, good afternoon, everyone. Can everyone hear me?
Yes, we can hear you.
Yes, okay. All right. So first I want to thank Cora Alliance and Jana for giving me this opportunity, and I'm truly honored to be kicking off the lineup, this phenomenal lineup of leaders and of mostly women that are taking the lead and supporting survivors and just, you know, women and people that are, everyone who's going through this. So my organization, Milagros Day Worldwide, is survivor led. So we are we are life coaches, and but more so are women who have lived through domestic violence. And so it's a very grassroots approach to the issue of surviving domestic violence and trauma as a whole. We've been operating for 10 years. The name Milagros came from my family history. My mom was Milagros. She lived through domestic violence very severely while I was a child, and then she, after she left the domestic violence situation, 6 months later, she was killed in a car accident. So she never had the time to actually find out who she really is. And so that was, I kind of like picked up where she left off, and all of the women who participate in our programs have already left the situation or are kind of like already on their way out. And so we provide that nurturing environment for them to find their purpose and to find their identity. And so during COVID, the thing that mostly impacted me was remembering when I was a child living in a household that was so violent and so volatile and not safe. And that was the one thing that really I felt, knowing that there were millions of children now trapped in this in homes where they couldn't escape even for a little while to go to school. Because when I was a kid, my escape was school, right? It was like the place where I felt safe was going to school, and now they didn't, and now they don't have that. And so it, for a while, for the first month or month and a half of lockdown, I was in my own, you know, what I was feeling and what I was going through. And being a leader of a community, that puts a lot of pressure on you, right? Because you know that people are counting on you to inspire them, and on you to give them guidance. And for those first couple of weeks, I was just going through a lot of anxiety, really severe panic attacks, actually. And luckily, I had my quarantine partner, which was my son, who would like walk me through these episodes. And he reminded me of who I am, right? So like one of the first uh, you know, suggestions that I have for this time is have a mirror, have someone who can remind you of who you are, have someone who can remind you of your success and of your greatness, so that you can snap out of it and fall into that role again, you know. And so one of the ways that I was able to do that, number one, was exercise, right? So whenever I would go into a panic attack, I would actually drop and start doing push-ups, and the push-ups were such a great release, and it actually shifted my mind into something that I can control. I can control right now the movement of my body. I cannot control the pandemic. I cannot control the lockdown. I cannot control the fact that these kids are locked in these homes and are being abused. But what I can control right this second is the movement of my body, my breathing, right? So that's another thing. So I have one moment. Okay, one minute.
1 minute.
So how?
Yes.
1 minute, yes. And so how I was able to channel all of that energy was creating our transitioning our programs into virtual, and we were able to do the Healing Voices 12-week public speaking course for trauma survivors. We had 40 women on this weekly Zoom, and we broke them into 4 groups. So they had their own mentors, and they were able to go through this curriculum and create their own talks, like their TED Talks. And then we were able to, in the spring, in the summer actually, get together with them in a socially distanced gathering in a park, in a beautiful park, and have them graduate from this Healing Voices 12-week course. And so that is just one way of transcending the horror that everyone lived through by channeling your energy into something that you can accomplish and that you can control.
Thank you, John, thank you so much. It's a terrific idea, right? Channeling the difficulties of this time into stories and getting to share and present them. So thank you so much. And anyone with questions for Dawn or comments, please put them in the chat box and we can come back around. Our next speaker will be Eileen Moran, whose organization is You Can Thrive. She is the director of programs there. And this is an organization that supports women with cancer to access holistic treatments in a way that's affordable. Eileen, I know that in addition to survivors of domestic violence, women with cancer are especially hard hit by this pandemic time. And so we're looking forward to hearing about you and your organization.
Oh, thank you so much. And it's a real joy and honor to be with amongst this legion of people who are doing such amazing work, especially at a time like this. It's when we really need it the most. So You Can Thrive has been around for 15 years, working particularly with the population of people impacted by a breast cancer diagnosis. I myself am a 2-time breast cancer survivor, and had discovered this organization when going through it on the first round, and realized that all of these modalities, when utilized as a multidisciplinary model, have such an impact. They potentialize each other. So how our model works, and I'll just quickly go into that just because it sheds light on, I think, the bigger issue of mental health and how people are potentially falling through the cracks. We do work with hospitals, and we get referred to by navigators there, people generally from friends or people who have been diagnosed. And we start off with an unbiased patient navigation intake. And that's an opportunity really to learn about all of these modalities, but also to get an understanding of where people are at. Everyone's coming, to a practitioner from a different place, and really meeting them where they are has been a key in having the outcomes that we've had. First, to gain trust and provide, then we provide tools for survivorship, which I'll talk about in just a minute. And we have seen over time that mortality rates have reduced. We tend to get people sort of who've fallen through the cracks, so to speak. And our model works both one-on-one. So we have psychiatric counseling, wellness coaching. Pre-COVID, we had massage. Now we do distant massage, breath work, polarity therapy, Reiki. And then we also do community offerings that are free. And since COVID, we ended up pivoting our model so to make it essentially accessible to people that are beyond breast cancer, people with other cancers, friends and family, and really serving the whole community with the public offerings, which are yoga and tapping and other mind-body approaches. So our model, I think, like a lot of you who are on here today, is truly integrative. And integration means multidisciplinary, but it also means an opportunity to really be integrated, and we're seeing the body as a whole. So our work is actually predominantly offered through volunteers, some of whom who have been through a diagnosis. Some people are friends and they just want to give back to this community. And then everyone that works for You Can Thrive is a survivor, mostly of breast cancer. And it's a women-owned, women-led organization. The modalities that we use are really broad stroke, from acupuncture to reflexology. We even do facials pre-COVID, pet therapy, emotional freedom technique, and most importantly, community support. Within the model, we have EcoThrive, which deals with essentially creating a setup for our patients that they have a survivorship plan, and they have access to, if you're a member, which is free to join, you have access to nutritional counseling bi-weekly. So that's, it's an opportunity really to kind of build step by step on one of the most important things, which is your diet and your own plan that you're at the vortex of. Then we have Exerthrive, which includes Qigong, yoga, and now dance therapy.
1 minute.
Oh my gosh. Okay.
Yeah.
This is a slide on our outcomes. Oh. Let's see. For some reason it's stuck here. Well, I mean, I guess since I only have a minute, I will say just the ultimate things, the therapeutic interventions that we have found to be the most useful are exercise, particularly with mental health, because it's igniting your endorphins. We've seen, especially in community, dancing in community, we've seen some amazing outcomes. Oops, okay, well.
You can take a few more seconds, finish your sentence.
Okay, well, acupuncture, we have data that acupuncture biweekly has been as effective as an SSRI, essentially because, like exercise, it moves qi. So our practitioners often give our thrivers auricular acupuncture and ear seeds that they can do themselves after the appointment. I have a lot more to share. We do sound therapy. We know that sound therapy works with harmonic overtones. That's a pivotal part of our programming. Pre-COVID, every Thursday we had a sound with Reiki event where people would have basically get the benefit of the relaxation response. And we found that over time, it's really helped. Well, I think I'll pass this. We have so much more to share.
You know what, Eileen, you presented with us with such an array of healing modalities that you use, and I know you have a website, and maybe you'll give people some contact information in case they want more info.
Yep, it's youcanthrive.org.
Right.
www.youcanthrive.org. And I just want to unshare my screen.
Eileen, yes, feel free to put any contact information in the chat box. You've presented us with such an array of terrific things, but let's move on. But really, I'm sure people will want to know more and can reach out.
For some reason, it's not letting me unshare my screen. So I don't know if there's a way in which you can control that.
I'll try to figure it out.
Okay.
But Joanne, you can move on while I work.
Okay.
Thank you. Thank you.
Let's see.
Thank you, Eileen.
Thank you. Yes. For our next speaker, we're going to go to Vivian Kurutz, who is from the Harlem Wellness Center. She is the founder, and she is the executive director of Harlem Wellness Center, which works at the intersection of racial, health, and environmental justice. They focus with a focus on building community. So Vivian, can you share with us about these issues that have come up for your organization about women and mental health in the COVID time?
Greetings, everyone. I'll start off with a quote from Dr. Martin Luther King that he shared at the Medical Committee for Human Rights held in Chicago in March 1966. He said that of all the forms of inequity, injustice in healthcare is the most shocking and most inhumane. I say that we work at the intersection of racial, health, and environmental justice because I've come to understand that the health justice and racial justice are interrelated. I'm very motivated by the information that is out on Black women and infant maternal health, and the impact that the social milieu that is very unique to the United States has on the bodies of Black women, and the devastating outcomes where women, you hear commonly that 3 to 4 times as much as losing their lives or the baby's lives in labor than a white woman. And so I am passionate about creating a space where women who are the nucleus of the family and in such a powerful role can be cared for. And we're here for everyone, but women are very special to my heart. And Black women are very special to my heart. And I believe that for us to heal as the racial divide, that we need to start where the wounds are really deep. So we do this through a holistic health and wellness program. I understand that it's important that we make normative, alternative, and integrative health and wellness practices. And we do this by making it culturally relevant and sensitive, and we do it by building community and joy around it. There's a very brief amount of time that we have here. And so with the rest of the time, I'm just gonna show you a video that really speaks to, you know, who we are as an organization. And just to give you a feel, you can always look us up online and learn more about us. Am I sharing the screen, the video? Yes.
Yes.
Yes, here we go.
Yoga is comprehensive. It's an integrated practice that pulls together healthiness in the physical body with healthiness and stability in the mind. I'd like to share the idea that taking responsibility for one's life is an act of service, an act of giving to other people as well. The healthier and happier we are, the more we share goodness, kindness, that inner peace. My name is Lalita Dunbar. I am a teacher here at Harlem Wellness. I live and play and thrive here in Harlem. I've been offering classes at Harlem Wellness since its inception, teaching yoga for 14 years. One of the things that sets Harlem Wellness apart is that when people come to class, they all know each other. Everybody knows your name. And I see in the students when they show up how happy they are to be there. Being a part of Harlem Wellness has definitely enriched my life and grown my personal community, my yogic community, and expanded my community of friends, not just students, but friendships. And getting to see people as they grow in confidence and physical ability is a really beautiful thing.
Thank you. I just wanted
Perfect timing. Just about 1 minute left.
15
A
seconds.
little bit left. Yes.
I just wanted to say that I wanted to show you that because that really speaks to the spirit and the community, and that is what's healing. And as we work to make integrative and holistic practice normative and to create a space where people can experience joy, where there's so much stress and where people don't have to go against the stream to practice alternative healing modalities, and there's a whole support system there. It really has built a health conscious community, and it keeps us coming back. And the word love is really one of the things that undergirds the work that we do. And so as we work to help people through COVID, we really feel that as teachers and leaders, we're at the front line because we're helping a community that has been devastated on so many levels by it.
Thank you so much, Vivian. And please again put any contact information in the chat box for everyone to see. And if people have questions, we're leaving plenty of time at the end. Next person who's going to speak is Dr. Laura Erickson-Schroth, who is a psychiatrist colleague of mine, and she is an assistant professor of psychiatry at Columbia and a consulting psychiatrist at the Hetrick Martin Institute for LGBTQ Youth, which is the nation's largest organization working with LGBTQ youth from, I think it's age 13 to 24, with direct services and referrals. And so Laura, perhaps you could give us some information about what's happening there at this time and what the issues are for LGBTQ young people.
Yeah, thank you so much, Joanne. Thanks for inviting me, and thank you to Coda. I'm super excited, and I like listening to the other people's presentations. Yeah, I'm a psychiatrist. I work at an organization called Hetrick Martin Institute. I just sent out the link. It's hmi.org. It's in Manhattan around Astor Place. And you're right, it is 13 to 24. They age out when they turn 25. It's on site at the Harvey Milk High School. So there's a transfer high school for students in New York City who are being bullied at other schools and things like that. And that's called the Harvey Milk High School. Hetrick Martin Institute is on that same site, and they run programs in the afternoons after school and on weekends. It's not just for students at the school, it's also for anyone who wants to come between those ages. We get a lot of homeless youth. A lot are living in housing like Ali Forney housing, Ali Forney Center, or at True Colors or places like that. So I thought I would just tell everyone briefly what's been going on during COVID at our organization. We've been almost completely online, virtual. Although there are a lot of physical needs that our youth have. We don't directly provide housing services, but we do a lot of the hooking them up to housing, setting up. I do a lot of supportive housing evals, things like that. We have on-site like free food, meals every day, snacks. We have what we call the pantry, which is where youth can get clothing, can take a shower, do laundry, get any like kind of basic needs met. We have lots of programming like groups and things like that. We have GED classes, and then we have a whole counseling kind of wing. And I'm part of the counseling wing. I'm the only psychiatrist and the only doctor of any kind that has ever worked there. We mostly have counselors, so like art therapists, social workers, drama therapists. So since COVID started, I've been completely virtual there. Which has actually increased the number of youth that I'm seeing for a lot of reasons. I think people are looking for more. They need more help at this time. And also we used to have a lot of like no-shows for appointments. I actually had just drop-in time because I would just say, like come by HMI anytime on a Tuesday while I'm there between these hours and I can see you. Because it was a lot of trouble, especially to get in from outer boroughs to come in, and a lot of people would be missing appointments. And now almost nobody misses their appointments. I probably have 8 a day when I'm there, and at least 7 will make it to their appointments because all they have to do is get on their phone, which has been really good, but it has also been, the volume has been up quite a bit. What I'm seeing is that, with a lot of the homeless youth, the things that they're going through in the shelter system are really difficult. So like a lot of them may have been in school programs and things like that. And the Wi-Fi at the shelters where they're staying is really bad, or they have rules about quarantine. So you can't leave and do the things that you need to do and come back in. Some are going back and living with their unsupportive families. A lot were kicked out of their homes. And some have gone back to live with unsupportive families because it's kind of better in their eyes during COVID than having to live in a shelter and having all these rules about what you can do. There's no place for them to go during the day. So they're like kind of just staying in their rooms at these shelters. If they're living at home with unsupportive family members, they're often very cut off from any of their communities. They don't have the same resources that they would have places to go like HMI, where they have people who are supportive of them. The ones that were in high school at the time are doing high school virtually too. They have almost no privacy if they're at home with homophobic parents or transphobic parents. And so sometimes they're even not able to see me virtually. They may like show up on the screen and like type to me or things like that. Because they really like can't say their personal business with other people in the family around.
1 minute.
Okay.
Yeah.
And then I do see a number of college students too, because we go up to age out at 25. And that I think has been also really, really difficult because they're expecting to be away from their parents in an environment where they might actually have more freedom, make friends who are also queer, those kind of things. And they're also stuck at home with parents that are sometimes unsupportive. So it's been really hard, but I've also seen a lot of resilience and a lot of people showing up virtually in a way that they couldn't before.
One of the actually good points about being in the pandemic time, of course, is that people can make their appointments and do make their appointments, right? Yep. Thank you so much, Laura.
Yeah, thank you so much for having me.
Yeah. And if there's anything else you want to put in the chat box, and if people have questions, please send them. We're going to be saving the chats as well as recording we're recording this evening. So thank you. Our next speaker is Ivy Wolf Turk. She is the founder of Project Liberation, which is the focus of Project Liberation is self-healing for people who are healing from the trauma of imprisonment. So Ivy, I'm going to turn it over to you.
Thank you, Joanne. Good afternoon, everyone. I'm Ivy Wolf Turk, and I am a certified life and professional coach and the founder of Project Liberation. And this was born out of my own experience when I was incarcerated. I was sentenced to 5 years in federal prison, was then released early, but ended up spending 4 years there, and learned what you can see on the screen, that when we're no longer able to change a situation, we're really challenged to see ourselves. And for me, reentry was much more difficult actually than being in prison, for reasons I won't get into now, other than to say I still had limited freedom, limited movement, and practically no resources. And I felt, as a white, privileged, highly educated woman, that if I couldn't make a go of it, couldn't find housing, couldn't find employment, couldn't find a way forward, what about the sisters I left behind? And so I went back to school, and eventually 2 years later founded Project Liberation, which is both a direct service and an advocacy organization. And if you could imagine a place that welcomes all women, no matter where they've been, where they could partake in a weekly workshop series, where they could feel safe and supported and empowered and part of a community again, and a place that really fosters self-discovery and emotional growth, where adversities can become their greatest curriculum for growth. And a place where they could express their own unique voice and learn essential tools that would give them the life that maybe they haven't yet dared to dream. Well, that's what we've created. And when COVID hit in March of 2020, we were very challenged. We were partnered with the New York City Department of Health in the Bronx and in East Harlem, conducting weekly workshops, while at the same time advocating to change the laws, which is the second part of our organization, to empower women enough to learn to advocate for themselves so they can then advocate for what's important to them, and then have it be a ripple effect. Because when a woman can advocate, not so much about what she's told she should or has to do, but really gets in touch with her intrinsic values through the tools that we teach, through life coaching and arts-based intervention and trauma-informed healing modalities, both ancient and modern, meditation, breath work, yoga. What happens is there's this ripple effect, and that ripple effect not only ripples into her for her and her own wants and desires and dreams, but that she sets an example for her family and ultimately for her community. And all of a sudden in March, as many of us experienced limited movement, limited freedom, limited resources, we had to pivot. Many of the women that were currently part of Project Liberation didn't have access. Most had phones, but most didn't have computer. And so the first pivot was to teleconferencing. And we reached out to all 378 of our alumni and then current members. And we created a group teleconference at the same time that our workshop series was, while at the same time I was advocating for women who were older and with underlying conditions that were already in prison. And I'm proud and happy to say that of the 33 women we advocated for, 33 are home, but there are hundreds and thousands more that we still need to bring home during this time.
One minute, Ivy.
Okay.
Yep.
And so what we have been able to do is graduate to Zoom. We have created a community, and we've really looked at the ways in which not only we've been imprisoned in ways of our own making, but identified the pathways that led us there. And COVID has actually been an adversity that has created opportunity, mostly that women need community. They need emotional support. They need tools and a toolbox, and they need ways to practice. And so I will put in the chat when we're done ways in which you can reach me and hear more. And I'll just leave you with this: empowered women empower women, which is what today is all about and what we're all about. And thank you, Yana and the Coda Alliance, for bringing us together.
Thank you so much, Ivy. And our next speaker is Dr. Luisa Ortiz Perez. And she is the founder and the executive director of Vida Activa, which works with, it's a helpline for women journalists and freedom of expression defenders who are experiencing online harassment and violence. And from what I read about her, she is a gender equality champion and a communications expert, among many other skills. So Lou, please, we're looking forward to what you have to share with us.
Thank you so much. I'm honored and I'm humbled, and I also need to share in the spirit of radical transparency that our family is going through tremendous loss and hurt at this moment. So I'm going to try to be as level-headed as I can. And I ask all of you to share and send a lot of light my way, because we are going through a lot. So maybe this is a good segue to talk about Vita. Vita came to our lives. It's almost 2 years ago. And as well as all of the other panelists have discussed, we had to pivot, and the pandemic was unfortunately a phenomenal spring into something that was going to challenge us to do even more and to be far more present in the communities that we worked with. Picture a journalist today. And many of the journalists, even, and we work primarily in Latin America and now in the US with Hispanic journalists and Latinx journalists. And picture that in our community, most of the people who work in the newsroom are women to start with. Second, most of the women who work in the newsroom are going about their lives and are going in the crazy news cycle that just a few days ago has just gone into a different stream of some kind of normalcy. But before that was a really stressful and a misogynistic space. And in parallel to everything that is happening, you have a digital life, and you also have the context of newsroom politics or even the organizational politics. And you also have your home. The task of caring, the task of supporting, and the task of accompanying all of those who are in your living space. Vita began as a place that offered psychological first aid. I am very, very honored by the mental health professionals here in the conversation. We are not. We are people who are trained in humanitarian response, which we thought that for communities that are so close-knit and also very, very closed to discussing mental health as well as vulnerabilities. And that's another conversation. We could talk about the whys in all of our communities if you want another day. But we thought that having peer support networks was going to be a very, very gentle and nonviolent way to ease folks into being more connected to their mental health. And that's how Vita began. Vita is a one-on-one conversation that you can have over digital media. So the pandemic didn't impact us there, but we went from a call or 2 per week to 5 or 6 per day. And here's where we are now. Our big pivot and our big aha moment was to consider that self-care could happen in unison or in parallel with community healing justice. So what we have is one-on-one support, and we also have community circles. And the community circles have proven to be absolutely insane in terms of the learnings, in terms of the solidarity, in terms of the support that people provide, and also the possibility of learning amongst us, the people that we care and the people that we trust, to learn to be stewards and sponsors of each other's greatness is something that's really, really, really cool. What is coming next for Vita? We are training new responders. Right now we're 12. We are all over Latin America. We speak a ton of languages, as well as millennial, centennial, boomer, and all of the languages that you can imagine. We speak languages as well as intergenerational speak, but we need more. So we are opening our responders training next week. And we also are innovating spring and fall retreats, digital virtual retreats for people to spend 1 or 2 days focusing on one particular aspect, which is very important to us, and it is digital security. The connection between online violence, consent, digital security, and mental health in enough time and in a loving environment so that everybody can, and I thought a lot of Milagros, everybody can not freak out and do the things that they need to do in the most, auspicious space. And yes, dear, I'm almost there. And we're also expanding our curriculum, and here is our support call for support and for help. We are actually also opening spaces for people to discuss burnout. So if you have ideas on burnout and trauma and mental health, we would really, really love to hear it, because it is the new pain. I'm going to copy all of our social media on the chat. I am very grateful for the space. I'm here for questions and answers. Lots of love. Yana, thank you for the Quota Alliance. We love you all so much, and we miss you all so much.
Lou, thank you so much, and thank you for bringing up about burnout. And we are all feeling for your family and your loved ones, and wishing for the best. Our next speaker is Professor Laura Suzanne Golosorki. I hope I'm pronouncing that correctly, who is the founder of the Center for Migration, Gender, and Justice. She is a human rights activist, and I see that one of their missions is gender justice beyond borders. So she is another one of our very international speakers. So thank you for what you're going to tell us.
Thank you so much. Let me go ahead and share my screen. And again, thank you to the Quota Alliance, our dear partner for years now, in fighting for gender justice beyond borders and also beyond binaries. So it's such an honor to be with you all today. I hope you can all see my presentation here. All right, I see some nods, so let me go ahead and share what I have prepared for you today. Women and mental health under COVID-19 has been a priority for us in pursuing our vision for gender justice beyond borders, and also our approach of being locally based and globally engaged. And so we believe that gender justice beyond borders necessitates shared agency, representation, and accountability in protecting human rights for all. And so at the Center for Migration, Gender, and Justice, we center migrant communities in all three areas of our work, namely research, advocacy, and education. So we're currently working on several projects that address mental health and gender in the context of migration, including forced migration. And so in all of these projects, migrant communities and local organizations working with migrant communities have joined us in conducting research, in developing advocacy strategies, and in implementing education programs. We have these three projects, as you see here, that are all ongoing, although some of them were planned to already be finished, but given the pressing times right now, we keep going. The first one that I wanted to briefly outline is actually based in Portland, Oregon, where I'm currently based as an assistant professor at the University of Portland. And it addresses the impact of COVID-19 on refugee women's livelihoods through community-based research, as well as through education. And preliminary findings from our research have been published in the International Journal of Sociology and Social Policy. And we're currently working on a book chapter contribution that is supposed to be published later in the year. And I'll drop the links for these after my presentation here. As for our education work, at this local level, we have offered English as a second language classes, so ESL classes, and tutoring for free online during COVID-19. And ESL classes and tutoring have really become a safe space for many refugee women and have alleviated feelings of isolation that have been heightened during the pandemic. A second project that I would like to highlight here concerns our project on gender and health justice for Venezuelan migrants. And this also carries a research component as well as an advocacy component. And so most recently, we co-curated a campaign for the 16 days of activism against gender-based violence. And the campaign focused on gender-based violence experienced by women, girls, LGBTQIA+, and gender diverse Venezuelan migrants. And really was driven by community engagement actually from including my co-panelist here, Lou from Vita Activa, and also one of the participants that I see here in the webinar, Venezuelans and Immigrants Aid. So thank you for these great collaborations. And the third project that I would like to highlight in this context before I go into some general patterns that we kind of delineated from these projects is our advocacy and research around the new European Union gender equality strategy. So in October, we co-organized an international conference on the strategy, and we examined policy gaps at the intersection of migration and gender. And in fact, the strategy itself does not mention mental health at all. And this is incredibly problematic given the gender dynamics that mental health carries. So in our guidance note that resulted from the conference, we urged the European Union to include mental health as part of any health efforts conceived in the context of the strategy, particularly in the context of
one minute.
Sorry. Yep. And so let me get to some of these kind of overall findings from these different projects in the context, again, of migration. So what do we see here? A first pattern that can be delineated has to do with access to health resources and services due to migration status, as well as interrupted infrastructures, particularly in conflict and humanitarian zones. A second pattern concerns lack of information about health resources and services. And here really our ESL classes have done tremendous work in terms of trying to alleviate some of the challenges there. As mentioned, the continued siloing of policy areas, right? So we have a policy area on health, and one on gender, and one on migration, but there's an absence of any kind of intersectional approaches here and trajectories moving forward. A fourth pattern that I want to highlight in a little bit with a particular note about Portland is the increased or renewed isolation and displacement that COVID-19 has brought for many refugee women. This was particularly the case here in Portland, which, as took the spotlight on racial justice protests and was met with severe pushback. So including an increased presence of the Department of Homeland Security and increased activities of ICE. And so this has all had significant impacts on the mental health of refugees. So fear, social isolation, and immobilities were heightened. And we saw regressions in mental health with post-traumatic stress resurfacing that was experienced by many. So let me just conclude with this last pattern that we delineated through these various projects is that persistent fear and stigma, largely due to ever-changing policy and migration and social welfare, but also generally given cultural differences and migration status. And so we're really urging for gender responsiveness in migration responsiveness in health. And I look forward to discussing some of these aspects further. Thank you.
Thank you so much, Lara Suzanne. And our next speaker will be Reem Katkuda. And Reem, I hope I'm pronouncing your name correctly. She is from Farik, Beirut. And as I see, also quite a media expert. And she will explain what Farik Beirut, a team based in Beirut, is doing in terms of peace building and ecology throughout various countries. And then after she speaks, she will then in turn introduce our last speaker, Alberto Botero, and who will speak about his program. So Reem, thank you. Here you go.
So, thank you very much. So am I able to share my screen?
Yes.
I'm trying. It says the host has disabled that.
Go ahead, try now.
Still.
Give it a sec, maybe it takes a while.
Okay. So I'm the founder of Farid Beirut, which was established as a reaction to the huge migration from Syria into Lebanon of a few million Syrians, and taking their trauma that they've experienced through war and mayhem and a horrific journey onto a country who already has its own trauma that has come out of war. Being a war survivor myself, I found that it was very crucial to really pay attention to the psychosocial support of the practitioners, but also the refugees, and also to mediate the relationship between the refugees and the host. So both are Arabs, they're both from the Mediterranean. They're actually very different. And it was very important to mediate that. So Farid Beirut was found to do just that. And we were able to I'm gonna sum up here. Can you see my slides?
Yes.
Yes.
Okay. So we did a lot of interventions with 53 families and also with being a glue of a lot of different organizations. And I don't know if many of you know that Syria is actually a matrilinear society. So any successful program needs to work in coalition from the planning stage onto the feedback and review stage with women and girls. So here are my two steering committee, Mutwalli Abu Nasser, who's the coordinator of Farid Beirut now. He joined us from Sweden. And Dia, who is in Turkey running a speech rehabilitation center, and with her daughter and son working with kids that have that challenges. We did psychodrama, we did a lot of different modalities. We worked with the Lebanese that had opened that center. We worked at formalizing more the workshop and training practitioner in media, used my background to do that. And where we're at is the focus is to integrate, study, develop, and deliver best practices for education and psychosocial support. To share expertise and successful programs with the US, the EU, and back home, and to support a youth center that we're working with now of refugees in South Lebanon and Dia Center in Turkey. And what we found is actually that financial trauma is as bad as anything else, and writing grant to do in self-empowered, powerful program that work on liberation and self-determination was very challenging. So it made much more sense for me to open a business, a financial brokerage that will allow us to fund our programs and others. And I stumbled on an opportunity that actually allows us to engage any other women that want to do just that, work with us. We, as you started the discussion, you talked about the need, the challenge under COVID of financial mayhem and difficulties. Well, being able to work from home was very important, especially for young mothers and women, and the ones that were the most hit by the release from the workforce were the mothers that had to stay at home with their children. So that is picking up, and we are moving it much further. The other program is to support our practitioners in their spaces. They are going through a lot wherever they are. And with COVID, it was really important to be able to support them and support their children. And we did that. I actually wanted to bust my business really successfully. So I reached out to Alberto Botero. Alberto Botero had been a trainer of a transformational training that I had taken in LA back in 2007. He was running an 80 people training that lasted 4 months. And he was training 10 trainers, and in parallel was running 3 such programs. So I knew that he was able, on one hand, to help me deal with my PTSD that really kicks in when you're confined, because you remembered being confined during the war, but also being able to bust through whatever is holdups in me to be able to become the success in a financial industry and allow a lot of people to practice with me, being that this is a space where people can work from home since COVID, like one of the speakers said, it was actually a great opportunity to have that put on us so everybody now can Zoom and we can do so much more efficiently.
Excuse me, Reem, 1 minute.
Okay, and what we discovered is one of the practitioners had reached to me and said that she had a very big challenge with her son, because since during COVID, to hold him at home, she had given him free rein to electronics, to computer, and suddenly as the confinement was less, she wanted to take it away and have him re-engage, and he refused. He used to throw such very violent tantrums. He would break furniture, he would break his sister's bedroom, the walls, be mean to the animals, to his sisters, and his anger tantrums were unbelievable. I reached out to Alberto, and I mediated by interpreting an intervention with Wasim and with his parents, a whole family thing. It was so successful that actually we ran immediately into our second thing, which is to train practitioners in his methodology and to heighten the visibility of thinking in images.
So, Reem, so that's 5 minutes. It sounds like you're just segueing into Alberto. So
Absolutely.
just wanted to let you know.
And he's from Colombia. He's the man behind Thinking in Images, Ego, Identity, Awareness, and Memory Perception, Redirect. And it's a sustainable methodology that has been very successful with us, whether we had it in English for success, for professional development, whether we put him to work with one of our psychologists, Shireen, who's with us on the webcast, which is doing her PhD, and whether it was to do that intervention with the family. He is going to talk more about his methodology and how successful he was. So much so that the young boy that we put working with him ends up saying, I was so angry. My sister was so angry. We were fighting, but I taught her what I learned. So now we can play a much more successful game. And she explains what Alberto's gonna discuss with us.
Okay, thank you, Alberto. And thank you, Reem.
Sure. Alberto?
Hello, thank you. I'm really surprised and inspired to see and hear all of you. At some point in moment, forgive me, I thought that I was feeling like not like I was working alone, but I didn't have that many contacts, and I didn't know there is so many people fighting for this. So it's very inspiring and very humbling in reality. So coming back with what Rim is saying, what we were able to achieve with Wasim is that express to him how the mind works. Thinking in images is a process and a method that I developed over 30 years of work. It develops in a way by itself. I was very conscious in not setting any premise because I cannot possibly know where these things is going to lead. So I didn't want to arrive to some wrong conclusions if I started already believing that I knew the answer. So as we know, what will keep us away from performing the best of our abilities in life and experience a more fulfilling life is what goes in our own heads. But how we do that? How can we stop listening to that voice that tells us that we're not good enough, that we are less than others, or in many cases, like people that I have been working with, people that have memories that are so gruesome and so painful that keep running their heads and block and throw a shade in reality. And all of a sudden we see everyone as our enemy encroaching in our space. And of course, by our actions, they feel like we're someone else that they didn't know. So this is how Thinking Images came up. It was a personal journey that I share with my clients. I'm from Colombia. When I was young, I went through a lot of therapies, a lot of psychiatrists. We looked everywhere, and we couldn't find the solution to the problems. It was very trying. I pretty much live in my own head, and through all this work, a whole concept and methodology start to appear. So at the center of this thinking images theory are some, in some ways, really daring statements as the identity is a construction of the mind and is represented physically in our brain. Most people know that. The identity generates its own thoughts, and we appropriate those thoughts. That's been proven with some studies with people like Michael Gazanigan, who is a neuroscientist, and also with a really innovative experiment study that they make. It's called orbifrontal neurofeedback. That, although that's not the conclusion that they arrive, because there is some assimilation in terms that we are our own thoughts and that we generate our own thoughts. But when in reality, those studies prove that the mind acts on its own, trying to protect us emotionally the same way it protects us physically.
Excuse me, Alberto, 1 minute.
And that's what the real problem is, because if we feel this thing that is physically, how could it not be real? So we become the fulfillment of our own thoughts. So what we want to do on my vision is to put this at the service of everyone. And like I didn't have an opportunity to complete the thing with Wasim, but it's only a 12-year-old that totally gets the concept. So this can be delivered to professionals, psychologists, to life coaches, to transformational coaches, and to regular people, teenagers. And it's accessible to everyone. It's about explaining them how the brain works and our relationship with our memories. Thank you very much.
Thank you very much. And now, thank you to all of the panelists. And we're going to open it up, I think, Jana, right? To comments, questions.
Yes, absolutely. Thank you so much. It's been like really intense. Wow, a lot to think about. And I don't see too many questions in the chat box, so feel free to unmute yourself as well, one at a time, and hop in and discuss. I imagine that the panelists themselves may have comments and questions related to the other panelists. So who wants to?
If nobody has a question, if you don't mind, let me illustrate and finish the example of Wasim. Would that be okay? Our client? Would that be okay?
Well, can we do it briefly?
Yes.
Okay, great. Go ahead.
So Wasim was having suicidal thoughts, and he was very cruel with the animals. Of course, leaving the war from Syria and being an immigrant and a refugee in Lebanon, that caused a lot of stress. So what I explained to him is that his thoughts and his memories were like it's like he's wearing a 3D glasses, which he actually owns a pair of those. And the reality that he's seeing in those glasses, the brain thinks it's reality itself. And that's how the thoughts are. So I told him, when you're feeling angry, and it's because those thoughts are being played in your head. So what you want to do is lift your glasses, which later on he shared with Reem that he did that 6 times. And then that's when he started to be engaged with his family. Because what that does, it frees them from the reality of his mind and creates a distinction between the past and here, and really solidify in connections with the brain immediately. That's what the result is, automatically rather than symptomatic. And then after that, he told his sister, which is 4 years old, which was being angry about the same thing. And he explained to her, what you're playing is a losing game. And she started to do the same thing and actually be more caring with him. And the funny thing is that at some moment, she was being difficult, and he reminded her of the glasses, and she screamed at him, "I don't care. I want to keep my glasses." Now, that although it's funny, it's very important to know that a kid 4 years old can make the distinction between the reality of their head and the choices that they're making is very profound. And this can be talked about at any age.
Thank you
You can
so
learn it if
much.
you're 70. Okay, that's pretty much it.
Yes, thank you so much. And I just want to invite anyone else to bring up thoughts, comments, questions, challenges that you faced and overcome, effective strategies, and also just a reminder, if bringing up something that might be triggering for anyone listening, to give us a bit of a warning about that. Yes, Reem?
So the reason why Wasim was in front of Alberto was actually a support for Dia, who is on our steering committee, who was running who is running a whole center, whose daughter is coming into her own with ideas of how we can make a difference for women in Turkey, both refugees and hosts. Do any others have issues where they were able to mediate between COVID, the children at home, and the mothers? I'm really interested in seeing how you've mediated that. For us, the gold was Alberto's methodology. Who else did what?
Well, if you don't mind, I'm going to share. I hope I'm not jumping the gun here.
Let's see if we can, if anyone else has something to ask or share.
I can
Yes,
share.
Ivy?
You know, 80% of the women that are part of Project Liberation are mothers. And it became a juggling act. And the way in which we dealt with it was to advise them to really get in touch with what was important to them and not feel ashamed or embarrassed if the needs of their children superseded some of the needs of their work or quest for work or education, and giving someone the freedom to really trust their gut, to really ask for support and help, and to know rather than fear a boss's ire or feeling that it wasn't okay to admit that they couldn't make a meeting, to ask for different work hours, to really be creative and authentic in the juggle. And so that willingness to really come from an authentic place rather than hide out of fear of not showing something that might be deemed inappropriate in the workplace was very important. Secondly, self-care. Always utilizing tools, even if it meant waking up early before the family or scheduling meetings after the last child was in bed, after taking time for breath work or tapping or whatever, some journaling, things that enabled the person to operate rather than on empty, on a full tank. And last but not least, a really good sleep routine. Sleep is restorative in so many more ways than any of us realize. And we're all tempted to tune into the news and tune into, what's been going on, and the limitation of devices at a certain point in time, and some sort of evening routine, whether it be a nurturing bath or shower, a reading of poetry, listening to a meditation app, whatever it was. So these things that they could depend on and look forward to and make a habit have really helped.
Thank you. Thank you, Ivy. And Lou, I see you have a question.
I actually had a question, but I also had something to say about Reem's concern, a lot of, probably 50% of the people who call the helpline identify themselves as caretakers of children. And one of the biggest holes that we find in the local context is related to intimate partner violence and the response of authorities in the context that we are in. There is no simple or easy solution. And we have begun to establish conversations that have to do with risk assessment, levels of safety, and really, and a lot of people talk about that online a lot. It's like there's tons of messages on Twitter, tons of messages on Instagram. If you're not okay, find somebody to talk to. Yeah, but nothing is really strategically placed, accessible for people to enact. So maybe what I'm saying is in the end of the day, we end up needing to trust state-sponsored solutions for problems that are very, very community-oriented and community-geared. And I find a big disconnect. And that's something important in our space.
Thank you.
Yeah, I'd like to add to that. Thank you so much, Lou, where you spoke about how the information is put out there, but all of the pieces aren't connected so that it's actually accessible. And so that brings me to think about the many people who recently have reached out to me to tell me how valuable the breath work we've been doing is for their lives. And that's something that we hear again a lot. Oh, you need to breathe, just breathe. It's not the same as being told as it is to actually practice it. And so across all of our classes, whether it's a chair class, whether it's a mat yoga class, whether it's a meditation class, we've combined our support group with a licensed clinical therapist with the meditation teachers so that there's both. And we understand through the science that the physiological benefits of the breathing and how it actually stimulates the vagus nerve and lowers the blood pressure and all of these things that we understand. But that is the key, is not only just saying it, but really creating these opportunities for people to experience it.
Thank you. I've got two questions here, one about women and substance abuse in the time of COVID, and another on women in age and technology in this time. I've got some experience in my psychiatric work with older women feeling the most isolated of all, especially if they're not able to use computers and they're limited to phones or have hearing problems or vision problems. And in my own work, I find that in some ways they're the hardest hit of all. Not sure if people have other comments on those two questions, and also Lou's question to everyone, 3 words that illustrate your 2021 challenge. We're down to our last couple minutes, so any quick comments?
Or if you prefer, answer, how do you keep sane in this environment?
Yes.
What are your tricks or your methods?
Shall we go around and everyone say their best in a couple words? Yes, I'll call on you. Lou, you're nodding your head. What's your best?
I would like to yield the floor to my sisters who haven't spoken today.
Okay.
Can I please share my experience with thinking in images? Can you hear me?
Yes, we can hear you. Can you give us just a word or two about what's been sustaining to you in this COVID time?
Yes, sure. Yeah, I went through a difficult time during 26 years that resulted in me having multiple sclerosis. And working with Alberto, I noticed that the multiple sclerosis wasn't due to, it wasn't an illness as it is, it was due to trauma that I have lived during these 26 years because my husband was bullying me all through these years. And that was very difficult to deal with. And then I came to Montreal. I left my husband, came to Montreal, where then Reem made me meet Alberto online, and he applied the thinking and images method. He taught it to me, like, yeah, he went through the thing and now I can like process the thoughts without letting them influence me. All the souvenirs, everything that has happened in the past during these 26 years, I could get through them thanks to this method. So really, I have experienced it, and now I'm experiencing it on my patients since I am a psychologist, and I have patients I follow online from Lebanon, and I follow them online from here in Montreal. So it's really very efficient.
Thank you for that, Shireen, and for sharing about that. And I did notice when I was reading about Alberto that his book, Thinking in Images, is available. So, Yana, I think I'm going to give you the floor for our last minutes.
Thank you. Yeah, thank you everybody so much for coming and sharing. Like I said, it's for me, I experienced this quite intensely actually. And, you know, the mind is an amazing thing, which I'm reminded of again. And I think that despite all the difficulties that we're surrounded by, there is so much hope in how you all approach these. And I so admire your dedication to the people you work with. So really happy to have you here, and continue. We would love to continue to, you know, promote your work and display your work and make it available through Coda Wellness, through the Coda Wellness program, which we're currently, like I said, you know, just starting virtually, but eventually hope to have in person as well in Northern Manhattan, where there is a population that certainly needs it, you know, with all the diverse backgrounds that they come from. So I think with that, I just want to say thank you to Joanne again. You've been a terrific moderator, and yeah, wishing you all happy week going forward, and let's get through this pandemic.
Yes, wishing everyone, I'm seeing the words, resilience, courage, networking, and follow up together. So look online,
yeah,
right, for the recording of this to share with colleagues and friends, other people in your organizations, and stay in touch. We've all got each other's contact information now.
Yes. And as you all know, as those of you who are nonprofits, you know, we all need like follow-up and impact data, etc. So I will be sending out a very short questionnaire tomorrow. Please take time to return it to us. Thank you so much.